it's important to follow with your urologist or cancer specialist after you have treatment for prostate cancer for surveillance, which typically comes in the form of a PSA blood test. It's also important for you to recover after treatment with a healthy diet, regular exercise, both mental and physical fitness after the cancer treatment to ensure a long, healthy life. It is beneficial to be established with a urologist because we are men's health specialists and we can help you with issues that may arise after prostate cancer treatment, including issues with erectile dysfunction and with voiding concerns. Surgery or radiation are used to treat prostate cancer, and in the process there may be damage to the nerves or blood vessels which provide a healthy erection. Also, androgen deprivation therapy is used, which can deplete the testosterone in your body. This can also affect quality of erections as well as the sex drive or libido. Surgical removal of the prostate for prostate cancer, known as radical prostatectomy, may result in stress urinary incontinence, which is leakage of urine from the bladder when you cough or sneeze or bear down. This typically gets better with time after surgery and with the use of Kegel exercises, which are strengthening exercises for the pelvic floor muscles. If you have radiation for prostate cancer, that may result in more irritative symptoms in which you may feel frequency, urgency, feeling like you need to pee often, or burning when you pee, which also should get better with time. And if not, we're here to help in the form of providing medications or other treatments to improve those symptoms. After surgical removal of the prostate, it will be normal to have some typical post-operative pain for a few weeks afterwards. Again, after the surgery, you may notice leakage of urine as well as difficulty with erections, but these typically get better with time after the surgical removal of the prostate. Now, with radiation treatment for prostate cancer, you typically don't have difficulty with urination or with the erections immediately during or after the treatment, but you may see trouble with erections develop over time after radiation. It's important after you have treatment for prostate cancer to eat healthy, live healthy, exercise regularly. Your overall health will be important for your recovery. The treatment options we have for erectile dysfunction after treatment for prostate cancer are similar to other men who present with difficulties with erection, which include pills, penile injections, a vacuum erection device, and an inflatable penile prosthesis. For the leakage of urine that may occur after surgical removal of the prostate, which is the stress urinary incontinence, leakage when you cough or sneeze, options include doing Kegel exercises, which is strengthening the pelvic floor muscles through repeated exercise throughout the day. Also, we have available sling or an artificial urinary sphincter. These act to restore the anatomy of the urethra in order to provide continence to prevent the leakage, or the urinary sphincter is a cuff that goes around the urethra, which actually will squeeze the urethra to keep it closed in order to prevent that leakage. With erectile dysfunction, you may have loss of penile length, and this is through the formation of scar tissue. One option is to avoid erectile dysfunction and use treatment options we have in order to restore good quality erections. Another option is to use a vacuum erection device, which you put the penis in a cylinder, create a vacuum, which then essentially stretches out the penis by filling it with blood with the use of the vacuum, which may help prevent loss of length. In order to maintain overall health, it's important to eat healthy, exercise regularly, reduce stress, and have good quality sleep habits, sleeping 7 to 9 hours a night. All of these things contribute to overall health, which contributes to our sexual health. It's also important to control other medical problems like high blood pressure, high cholesterol, diabetes, and in doing so, in managing those conditions, you will preserve your sexual function in the long run.